Hi, my name is Joseph Betancourt. I'm Senior Vice President for Equity and Community Health at Mass General Hospital, also a primary care doctor here as well.
How did you get started getting interested in this area of combating misinformation?
Yeah, so I'm originally from Puerto Rico. I grew up in a bilingual bicultural home. My whole career has been devoted to kind of disparities in healthcare, improving access, and vulnerable communities. So, I have lived experience understanding that, healthcare for people where I come from, it's not easy to access. When you access it, it's not easy to understand your doctor. Sometimes they speak in too technical terms or they don't speak your language. And a lot of times you don't understand them, you don't feel like they understood you, and you don't have questions that you felt comfortable asking. And so, we took those concepts and said, well, we know this is all going to be magnified with the vaccine, given all the issues around speed of development, a new type of vaccine, an mRNA vaccine, general mistrust. And so, if you layer those two things together, I've always been committed to getting people the information they need, kind of, whether it be about diabetes or hypertension or asthma. This is a natural extension of that. And I think it gave us a chance to, and me a chance to not just do it here in my office, but to do it out in community. I think that's been, really gratifying and very engaging, especially in a time where, we've been less connected as people.
For vaccine outreach, like Mass General Brigham does some sort of outreach at an institutional level.
So Mass General Brigham, we've taken several approaches to do outreach around vaccination. As it relates to our patients, we've made sure, and our communities, we've made sure to center equity in everything we do. So, briefly on our patient side, we reach out to a lot of patients through our electronic health record through Patient Gateway. To make sure that we're getting vulnerable populations included in how we're reaching out. We also text and we do auto dial, which are robocalls, just to make sure that we're doing kind of high touch, low tech as a way to make sure that we're reaching, our vulnerable patients. I'll say also that to facilitate vaccination for our vulnerable patients, we prioritize them in each phase so that every time we go through a phase, we reach out to those who are in the 14 hotspots that we've identified first. And we prioritize vaccine supply by putting it in our community health centers, including places like MGH Chelsea, MGH Revere, and Brookside Health Center, as well as up in Pentucket. And then finally, I think a key part of our outreach has been addressing lack of confidence, or another term we use, vaccine hesitancy in vulnerable populations. And I'll just say that we fundamentally understand that for a lot of different reasons, communities of color have been hesitant or have lacked confidence in kind of rushing to get to the vaccine. We anticipated this. Survey showed that communities of color, and not just communities of color, we've seen a lot of different kind of demographic groups be hesitant and not be interested, quite frankly, in the vaccine. I think there's a difference between people who don't want it versus people who just want to see that others have gotten it and I think have done okay. And I think for communities of color, it tends to be the latter, that the surveys showed that they just didn't want to be first. They wanted to make sure that others have gotten it before they felt comfortable. And I'll say that, that sense of mistrust is quite frankly well earned with our nation's history of racism, segregation, medical experimentation. The surveying really bore out the truth that, in fact, many of these communities who haven't had a great experience with healthcare and where a vaccine has been kind of moved through fast, right? Operation Warp Speed. This has given, particularly communities of color pause. And I think in large part it's due to the fact that, they're not getting information in a way that is at their level of health literacy by people who look like them and in their language. And so all those things further add to the mistrust and the lack of confidence in vaccines. So to address that, we created something called our Community Messenger Initiative. And this is an initiative whereby we have identified across our Mass General Brigham system 140 caregivers, mostly caregivers of color, who form now a roster. And that roster is deployed in 4 different ways. First, we make ourselves available to multicultural media. So we do Facebook Lives, interviews with outlets like El Planeta, El Mundo. We're doing some stuff with the Bay State Banner and the like. Second, we partner with community-based organizations, faith-based organizations, employers who reach out to us for one of our community messengers, one of our trusted messengers, to participate in town halls and Q&A. So we avail ourselves to those ways of communicating with our community as well. Third, we ourselves here at MGH are putting out Facebook Lives in different languages to get out information to communities. And then finally, probably our most important effort among the community messengers, our mobile effort. So we have 3 vans across our system, and we work with communities to decide where we're going to park these vans. And these vans come in to a community with a couple of our community messengers, our caregivers of color. We park. We have care kits that we give out with masks, hand sanitizer information. And so that brings people to us on the street side, on the curb and kind of in busy city squares. And when they come to us, we begin to talk to them about, hey, have you thought about the vaccine? Do you have any questions, any concerns? We do this in multiple languages. I myself, originally from Puerto Rico, I'm a Spanish speaker, so I do this in Chelsea almost every Tuesday afternoon. And so it's incredibly valuable because in addition to some of these broader strategies, we get into these kind of onesie-twosie conversations that are really important and get people, the information they need in a way they can understand by a person that they might trust and addressing their specific questions. So those are kind of the key ways in which we've both attempted to improve our outreach, to vulnerable populations, both our patients and our communities, and really address vaccine hesitancy.
Thank you. That's really wonderful. And you just mentioned that on some afternoons you do some outreach on a personal level too, right? So what are some of those interactions like?
So it's great. I'm heading to Chelsea just this afternoon, and it's really wonderful. People are happy to see caregivers, doctors, nurses, and others in community, right, as they're getting off the bus and walking by. So I'd say number one, the access to us is very easy, and we try to be engaging and easy to speak with. So we're there kind of on the sidewalk and ready to engage people. So I'd say that's one. Second is I'm engaging people in Spanish, which is one of the primary languages in Chelsea. So I'll reach out to people, and I think that's very gratifying. And then third, I'd say what's really important is that we found that people, yes, have basic questions. We answer them. But I'd say that, the amount of hesitancy differs community to community. And in our experience in the Latino community, the hesitancy tends to be less. We worry about misinformation filling the void, but we also have community messenger activities going on in some of our Black and African American communities. And so, we need to understand that this is a significant issue among vulnerable populations, but the level of it varies community by community. And we're committed to going to every community and being available to anyone who may have questions. And the interactions are very, very gratifying, and we think very beneficial to people. We definitely get people from, I'm thinking about it too. Hey, I'm ready to get it. Where do I get it?